video number 2, just had to check to make sure the last video had recorded, because I was a little bit concerned in case it hadn't, but it had. So now moving over to video number 2. So she talks a little bit about the male to female, Hape that is, Francesca Hape, talks a little bit about the bias. There's the gender bias where if there's a boy struggling socially, someone might think, oh, could it be autism? Whereas if it's a girl, they're more likely to think, oh, she's shy, sort of thing. Now, I agree with Hape, there is a bias. Historically, people tended to think autism didn't occur in girls and women, and they tended to think boys autism, and they had this very kind of like sexist idea about autism. And it was often the kind of geek stereotype, heavily focused on the type of interests they were into. So people had this kind of stereotype of an autistic boy obsessed with trains, sort of thing, the train spotting stereotype, and it all fell into place. It's kind of like extreme male kind of presentation, like, oh, it's like extreme boyness, obsessed with trains, doesn't really like interested in people. They took that kind of male stereotype, the aloof and distant male, and they kind of they saw autism as like extreme of that. So yeah, there is that like bias, and then obviously many women, and actually, by the way, it's not just girls and women. To be fair, there are lots of boys out there and lots of men who also don't fall into that stereotype. And what you're interested in has nothing to do with autism, okay? That is important to understand. What you're interested in bears no relation to autism or the extent of your autism, how severe your autism is. It's got no relation to it at all, okay? Interests are interests. What matters in terms of autism is how you go about that interest, the intensity. You could be interested in anything, it doesn't matter. It's the intensity of that interest, and it's how you go about that interest, which will be different if you're autistic in a massive way to if you're not autistic. Like with my interest in Kate Winslet, yes, many teenage girls are very interested in movie stars. Some would say even to the point of obsession in inverted commas, because obsession, there's obsession and then there is obsession, isn't there? Obsession with a small o. But it is true, many teenage girls are obsessed with movie stars. Whatever, we'll have pictures of them on their wall, we'll idolise them, we'll think about them a lot, we'll collect all the merchandise, whatever. And yet they can still have friends, they can still go out and do other things, they can still engage in other interests. They're not going to be sitting there obsessively watching one scene over and over and over again and having extreme, meltdowns, whatever. They can go out with their friends and still do other stuff. It's different. It's different in quality, isn't it? It's not just for intensity, it's also for quality. Yeah, it's different. It just is. But because of that bias, historically people wouldn't have thought autism, even if the interest itself was extreme. They wouldn't necessarily think autism, unless it was a boy obsessed with trains. The other thing that was mentioned, Hape says, is that they might go to the GP and be told, oh, you can't be autistic as you're married, or you're making good eye contact. Of course, you can be autistic and get married, you can be autistic and have good eye contact. I do think, though, generally speaking, you're less likely to be married if you're autistic, just because of the social impairments. But it's not impossible. You can be autistic and be married. It's just for many autistics that is very unlikely. But it's not, it's not a blanket thing. You can be autistic and get married. It depends on the whole context, and how much support you've had, and, often maybe parents have been arranging things for you, all those sort of things. We don't know the circumstances. It's a whole picture that needs to be talked about. Okay, and then Christine said, like, people might often have come up to her and said, how are you able to go to events and awards if you're autistic? And she talks about masking. And again, I've talked about masking in some of my videos. Again, I think it's a big topic, it's a controversial topic, this whole masking thing. But yeah, she talks about masking. And then Hape talks about strategies, conscious and unconscious, that we develop to use, that autistics develop to use to try and look as neurotypical as possible. She says it could be active behaviours like copying, for example, having a little script that you're going to use in social settings, and seeing how other people are behaving. So if somebody else is laughing at a joke, then you laugh as well. I've done that a bit myself, like if someone's say joking and I don't know what the hell is going on, I'll just like smile like that, I guess you could call that masking, I don't know. It doesn't help me get by in life, so it's not hardcore, but someone, yeah. And Christine talks about always practicing conversations. Personally, I don't always practice conversations. When I was a teenager, I did used to script a bit more, and I did actually write in one of my diaries about doing that. So I've definitely done it in the past. And bearing in mind, as a teenager, I didn't even know how to hold a basic conversation. I've come a long way since then. As a teenager, I could not hold a basic conversation. It was extremely awkward. I've developed my communication skills are a lot better than when I was younger. I can now hold a conversation. I've got a lot better at doing that. It's still really, really hard work, and I don't understand it, and it's mechanical, but I can now do it because you do grow and develop as you get older. But I don't practice conversations as such. I do like to be prepared for conversations, though. I don't like unexpected conversations, and it depends on the conversation I'm having. To be fair, like sometimes I do like sometimes to interview people a bit, and then I will take notes and ask them questions I've rehearsed beforehand. So I do that sometimes, but not all the time. It depends who I'm talking to and what's going on. It depends. I don't do it for every single interaction. And then Hape talks about the swan analogy, like flippers underwater and looking calm on the surface, sort of thing. Yeah, that swan analogy is very apt. Like, I'm very tense, but I can look quite serene, and people don't always realise how much I'm struggling. So again, she goes to meet some autistic people. So Christine first of all, she meets someone called Leanne in Bideford. I'm not sure if Leanne actually has a diagnosis of autism yet, or whether she's still going through the process. That was not made clear. But it talks about how her autism had been misdiagnosed and resulted in mental health issues. She's 24 years old, and she struggled with mental health since the age of 13, mainly anxiety and panic attacks, and she has very oversensitive hearing. She was diagnosed with social anxiety, then bipolar. She was put on medication, and she's had therapies. And then Christine McGuinness speaks to Leanne's mother, who describes how Leanne was a solitary teenager, and she liked to wear her socks inside out because the seams would rub her toes, so she had obvious sensory issues going on, but no one looked deep enough to find the cause. She then started self-harming, she overdosed, she cut her arms, and she was in numerous units, both for CAMS, that's the Child and Adolescent Mental Health Service, and adult units, and she was also detained under the Mental Health Act. And she was diagnosed with a personality disorder at age 18. Again, her and her mum begged a consultant to consider looking into an ASD diagnosis, but he was dismissive. Her mum first mentioned autism to Leanne, and that was like a light bulb moment for Leanne. But it took another 18 months. But for another 18 months, she was dismissed by health professionals, so she had to fight. And then she had a new nurse when she was discharged from hospital, and after 2 weeks of meeting Leanne, she asked Leanne whether anyone had mentioned the fact that she might be autistic, and Leanne said, Mum said that. And since she's found out, she stopped self-harming because I guess she feels a bit more secure. It didn't make it clear whether or not she has an official diagnosis, but that was a little bit left in the open, like has she gone and got officially diagnosed, or is this at the moment still supposition? That wasn't made clear. But again, so that was the first person she met. Then Christine speaks to Dr. Emma Colvert, who's a chartered psychologist specialising in female autism. Again, that problematic term, which I'll come back to later. So again, she looks at whether or not autistic women are better at hiding it, whether or not teachers aren't noticing or parents aren't noticing because of the idea it's male. So yes, she seemed to come down on the idea that women and girls are better at hiding it. Now, personally, I disagree with that. I don't think that women and girls are necessarily better at hiding it than autistic boys and men. I do think it comes back down to that bias that other people have about autism and not seeing it in women and girls, even when it is very, very obvious. I've never hidden my autism. It's been glaringly, starkly obvious since I was a toddler, basically. Which is why my mum knew I was different since toddlerhood, and at first she blamed herself. She thought it was something to do with, because we'd moved house at that time, she thought it was to do with that, and maybe her stress had been wearing off on me. That's what she said she thought it might be. Later on, she did start to wonder whether it might be autism, but because I was very happy, and because I was very energetic, and because I was very alert, and didn't seem to... I was a happy child, you know. I was a happy child, I was a healthy child, I was an alert child, I was very energetic, She thought me being energetic was, yeah, I was very energetic, but she thought that was kind of just a genetic thing, runs in the family. So, yeah, she kind of thought at the back of her mind, maybe, but she put it to one side, and, I guess because she didn't really want to think it was something like that, and she worried about what repercussions it might have further down the line in terms of employment and stuff, what a label would do. There wasn't much understanding about autism back then either. Teachers were aware of my difficulties from nursery school. I wasn't interacting. It was obvious. I was classic Asperger's. It was all there. I got assessed stage 9. It's all there in a report. All the problems, all the classic problems, eye contact, social interaction, motor problems. It's all there. Special interest, yes, didn't think about anything other than food. That was my special interest. Routines and stuff. So it was all there. So nothing was hidden. I was never good at hiding it. I was obvious. It's just that people put it down to other things. Well, teachers did. They put it down to, I don't know, I think they saw it more as the fact I had learning difficulties and I was an enigma, as a year 1 teacher called it, and it was parents' fault. They need to socialise more with other parents at the school gate, and a confidence issue. I think that's what they thought it was. So I think it comes down to bias, but I don't know if I was a boy whether it would have been any different. I can't say, because I would have to go. You'd have to do a sort of experiment, which I can't do. But yeah, I disagree that women and girls are necessarily better at hiding it. I know I'm not. I can't hide my autism for toffee. But yeah, I think it more comes down to the fact that teachers, although teachers did notice in my case, they didn't explain it as autism. Okay, my parents definitely noticed that I was different from day 1, and like I said, I don't think it was because I was a girl. I'm not sure. My mum is no longer around, so I can't really ask her that. I think it was more just because of other stereotypes around autism, like autistics kind of, I don't know, not being alert and stuff like that, or, because I was happy and things like that, but also because she was worried about what a label would do. I think it's more down to that, really. So, Christine, as I said, so it talks a little bit about Christine's background. She grew up in Liverpool in a council estate with her mum and 2 siblings, and grew up in the 90s when there wasn't much understanding of autism, and she was diagnosed in 2022. She has a sister and a brother. She talks about how she threw chairs in a classroom screaming because she found school stressful. It almost sounds a bit like ADHD, if you ask me. I do sometimes wonder whether some of these people are more ADHD than autism. But anyway, let's carry on. She talks about how she stopped her periods. She had an eating disorder, which was all sensory related, around the age of 14. The school canteen was too overwhelming, so she stopped eating at school. She struggles with texture and smell, and she only eats food that's dry and beige. And then she talked a little bit about counting calories, and exercise can become an interest, developing strict rules. Obviously food is my major interest and passion, but I'm completely different to Christine. I love food. I love it. It's a massive special interest, and that's been a long-term special interest for me. So I differ there. I don't fit into that stereotype of autism of people just like having very restrictive diets. For me, food is my all-encompassing obsession. People don't often understand that, but it is all-encompassing. It is. I mean, anything you get interested in if you're autistic happens to be all-encompassing. Cooking is a very long-term one for me, and I love food, and I eat an extremely varied diet. I guess I am lucky. It's one of my interests because it serves me well on a health front. It's a worst interest I have. I've never had restricted eating. I've always had a very varied diet. I eat healthily and normally, and I'm very interested in nutrition, but not in a disordered way. It's actually a very positive thing. I mean, obviously I have OCD, so that can impact sometimes, like food, like hygiene, that is in, I worked with a psychologist to overcome my issues around handling raw fish because of the OCD contamination issues, but I've kind of, not completely overcome it, but I've overcome it to the extent that I can now enjoy fish and cook with fish. It's just I wash my hands a bit more than maybe your average person, but it's not too bad, and I've definitely kind of pretty much overcome it, yeah, so that's positive. But I don't have any issues with food like from an autistic fun. It's actually my major obsession, so that's positive. And actually, because I am interested in food to such an extent, that actually helped me overcome my OCD around it as well, because I could use my interest as a motivator as well, because I love fish and I want to eat it, so that helped me overcome the OCD around handling it as well. So yeah, anyway, so she looks a little bit about autism and eating disorders, and apparently there is quite a high percentage of autistic people who have eating disorders. Thankfully, I've never had an eating disorder. That must be one of the worst mental illnesses to have. I mean, I think OCD is pretty bad, but an eating disorder can essentially kill you. I do think that probably out of all the mental illness out there, eating disorders is the most risky to health in a way. Because they literally stop eating and it can cause such extreme damage to their body and stuff. So I've been very fortunate. I've never had an eating disorder. Yeah, so because I love food too much. she meets someone called Fee who's been battling anorexia. She had anorexia for 10 years, but it was not until 2020 that doctors realised that Fee might be autistic, and now she's on a new autism-friendly treatment plan. She got an eating disorder at the age of 14, but she said for her it's never about weight loss. It made her feel that she could understand things, so it's more about control. Giving her sort of control in a confusing world. You often hear that, by the way. It's not actually always about weight loss. For a lot of women, it is about other things as well. That's a bit of a stereotype about eating disorders. And then Christine also talks about how she's had an eating disorder as well since a teen, but for her it's very much a sensory thing. And she also talks about how she likes a plan, for example, when meal times are. And then Fee talks about how she's looking at returning to university in September. She's got a job, so things are looking more positive. And then Christine meets Dr. Kate Chanturia, who uses an autism-friendly approach to treating anorexia, and she's a professor of psychology and eating disorders at King's College London. And she decided to assess every eating disorder patient at Maudsley for autism, and a third of the patients would meet the criteria for autism. And dietitians are discovering that the so-called beige diet, which has less odours and less texture, is good in helping eating disordered autistics in treatment, because a lot of eating disordered autistics have real sensory aversions to food, so that's why they find that beige diet can work. Like I say, I'm completely opposite in that, because I don't meet the stereotype there of autism, because I have a really, really varied diet. I'm stereotypically autistic in other ways, but I love food, so yeah. For me, it's actually a sensory pleasure. It's more sensory seeking for me. Okay. I think this is going to turn into like a really, really long analysis, and I just don't think I'm going to be able to cover it all today, because there's just so much to talk about, and I also want to kind of introduce some more of my own thoughts around these highly successful celebrities doing documentaries about autism and the pros and cons of that. Because obviously, like, Christine is miles away from me, miles away, to the point where I even think, do we really have the same condition? But anyway, that will be a topic for another day. So, thank you for watching.